Okay, so thank you guys so much and welcome to sleep apnea and insomnia. I think that at some point in life we all have issues with hard time sleeping. Most people have an issue with snoring, so it's nothing like snoring is not definitive for you have obstructive sleep apnea, but it depends on the kind of snoring and stuff that you're doing. So if you're having issues with this, obviously at the end, feel free to make an appointment or talk to me. At any rate, so what is sleep apnea? Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts. You may have sleep apnea if you snore loud or if you feel tired or even if you had a full night's sleep. So usually people tell me I sleep 8 hours, 10 hours. I have no problem with sleeping, but I feel exhausted, or I'm falling asleep while I'm driving, or just excessively sleepy during the day, or their partner might wake them up and say, hey, you stop breathing, that kind of a thing. So the causes, this causes you to stop breathing from anywhere to a few seconds, even to a full minute. So the types, there's obstructive sleep apnea, which is usually what people have. This is a more common form that occurs when the throat muscles relax. There's central sleep apnea, which occurs when your brain doesn't send the proper signals to the muscles that control your breathing. And then there's complex, where you have a bit of both of the obstructive and central. So obstructive sleep apnea, during sleep, gravity in the muscle relaxation allows the tongue and the surrounding soft tissue to fall back into your throat area and obstruct your airflow. Symptoms, so loud snoring, which is usually the most prominent symptom. Episodes of breathing where you actually stop breathing and it's witnessed by another person. Abrupt awakening accompanied with shortness of breath, so you wake up gasping for air. Awakening with a dry mouth or sore throat. Morning headache, difficulty staying asleep, and then excessive daytime sleepiness, and attention problems or irritability. So did you know that obstructive sleep apnea patients are at high risk for serious health conditions, especially cardiovascular disease, so coronary artery disease, diabetes, congestive heart failure, being obese or overweight, and then drug-resistant hypertension. So some side effects, there's conditions that arise from having issues like high blood pressure and diabetes. It can also make it more dangerous for you to be out on the road. If you're excessively sleepy and you're driving and you have a central sleep apnea, you might fall asleep behind the wheel. So it just kind of gives you a little bit more of a view of this. So sometimes people will have problems with their memory. They can lead to dementia. You can have a stroke, headache, lung hypertension, heart attack, arrhythmias. I've had patients who had sleep apnea and ended up getting atrial fib also behind it because it was untreated. So it definitely can lead to congestive heart failure because he ended up getting congestive heart failure with it. Job impairment, if you're not able to function. We've had people fall asleep behind the wheel and get a motor vehicle accident. And we talked about diabetes, fatigue, drowsiness, obesity, and impotence as well. So why does sleep apnea cause snoring? So in sleep apnea episodes, the tissue literally falls down and obstructs your airway, and this definitely keeps you from being able to pass air, and then you get a vibratory sensation and you end up snoring. So common treatments, usually it's CPAP. If somebody's got more central sleep apnea, then you can get what's called BiPAP, which is giving you forced air as well. It's the same kind of a mask and stuff like that. But usually CPAP machines, you see advertisement for it all the time. And get them cleaned and where to wear and how to wear. They got really portable ones. If you're afraid or claustrophobic, they have the one that can just go in your nose as well. So this is like a CPAP machine at home. So there's a mouthpiece. So the FDA has approved the treatment, a dental device And for mild or moderate obstructive sleep apnea, severe sleep apnea, you're going to have pretty much CPAP, but unless you cannot tolerate a CPAP, then you can get a mouth device. And this is what that looks like. And sometimes people get braces to bring their jaw up. So what is insomnia? The definition of insomnia is a condition that occurs when a person is unable to get long enough or refreshing sleep throughout the night, an inability to fall asleep, an inability to stay asleep, or waking up too early before it's time to get up. Okay, so symptoms: difficulty falling asleep despite being tired, waking up frequently during the night, trouble getting back to sleep when you wake up, like maybe you went to the bathroom, unrefreshed sleep, relying on sleeping pills or alcohol to fall asleep, waking up too early in the morning, daytime drowsiness, fatigue, irritability, difficulty concentrating during the day. I think I've had like all of this in one way, shape, or form. I think the most frustrating is you're tired and you want to go to sleep and you cannot fall asleep. That's frustrating. Or you get to sleep. Sometimes you're what's called wired and tired. So you've been like, go, 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 go. You got a million things you did all day. Go, 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 go. And then you're doing that up until the time it's time to go to bed. And then you go to bed because you're exhausted. But then you're back up because your body's still on that go mode. So you never went back into actual sleep mode and you didn't stay there. Or the most annoying thing is waking up too early. Like maybe you're anxious about the next day. You know, you have a meeting or you have something you got to do. You're nervous about, and your body wakes you up, and it's like, oh, okay. And then whenever I do that, then at the last minute, I'll fall back asleep, and then I oversleep. Yay! So I definitely have experienced a lot of this. So things that can cause it, I mean, if you're sick, if you just don't have time, sometimes people just literally don't have time to sleep. Bills, you're thinking about your bills. Stress, work, maybe you work a shift that doesn't allow you to sleep at night. Stress, no sleep, fear, worried about something. Maybe there's something going on in your family. Late nights. Some people like to, you know, they go to work at 5 o'clock in the morning. They get off at 3, but they're off at 3. But to them, bedtime is not till 12. But you got to be up at 3. So they're just keeping that. There's a lot of things that can keep you up. Overtime. Maybe you're working 16 hours a day, and you don't have any time. Like, because what we always do is even though we don't have time, we make time. So it's like, I might work 12 hours, but I still want to spend time with my kids, or, you know what I mean? Still have a relationship, go to the gym. And then what always lacks is our sleep. It always takes a backseat to everything else we want to do. So in order to properly treat and cure insomnia, you need to become sleep detective. Okay, so emotional issues such as stress, anxiety, depression cause half of the sleep issues, but your daytime habits, sleep routine, physical health may also play a role. Try to identify all possible causes of your insomnia. So these habits affect your ability to fall asleep and compensate with unhealthy habits, feel fatigued, stressed during the day, and then you sleep badly at night. So what are some things that can cause you to have a bad night's sleep that you guys might have done or do? Anybody?
Too much caffeine?
Yeah, I mean, people are drinking caffeine up until the moment they go to sleep, and then they can't stay asleep, and they're like, why can't I stay asleep? It's a huge one. Like, especially, I think the energy drinks, too, like with caffeine in it. People drink those like just water anymore. What else? Anybody? Marisa?
It says don't use electronics 30 minutes before going to bed.
Yeah, we're stimulating ourselves all the time, so we're constantly being entertained. You got TV on, radio on, cell phone, laptop, tablet, a lot of electronics, so your brain is constantly up, it has to be awake and alert for those things. What other kind of things? Anybody? A lot of beer, alcohol. A lot of times people are having a lot of that, and the catecholamines and that can also wake you up. It puts you to sleep, but then you'll be waking up. So there are some medical conditions such as maybe you have a problem with your thyroid, and that's not helping you sleep. Maybe your testosterone's low, and you'll have issues with sleeping. Maybe you have depression, anxiety, like I said before, you're having issues with sleep. Maybe you have restless leg syndrome, and it's keeping you up all night. There's a lot of things that can be a medical cause for it. So if you think like, hey, I don't have any of these other problems, maybe there's a medical reason, we can always go over that together. So nasal and sinus conditions, huge. If you're congested, chronic sinusitis, maybe you have GERD and the acid is burning and keeping you up all night. Maybe an overactive thyroid, arthritis can, pain will keep you up. Asthma, hard time breathing, neurological conditions like Parkinson's disease, chronic pain, and then low back pain. And the pain will definitely keep people up all night. So, if you have problems with insomnia, you're going to have a lower performance, slowed reaction time, risk for depression, risk for anxiety, a awful immune system. You need your immune system to be asleep for 7 hours to reboot. High blood pressure, more strain on the heart, right? Risk for heart disease, risk for diabetes, and risk for becoming overweight because it's not like you're just up, we're usually up eating at night, and that'll keep you up too. So sleep deprivation, irritability, cognitive impairment, memory lapses, like what was I doing, what was I thinking? Impaired moral judgment, severe yawning, hallucinations. I mean, that's like if you've really been up. Symptoms similar to ADHD, impaired immune system again, tremors, aches. So adjustment insomnia, behavioral insomnia, idiopathic insomnia, meaning it's no reason or no cause that you can identify. Inadequate sleep hygiene, like you're up all night on a tablet, TV, or drinking coffee. Paradoxical insomnia, and then psychophysiological insomnia. So adjustment insomnia also refers to acute insomnia. Is characterized by difficulty in initiating or maintaining sleep that lasts for a few days to weeks. This contrasts with chronic insomnia, which is going on for months or years. So studies show that 15 to 20% of adults experience adjustment insomnia at least once a year. Or maybe you were in China and you got to come back and like everything's thrown off. Just me going to Vegas, that threw everything off for me. Like for days, I was like, I was 3-hour difference. Makes a big difference. I was so tired in Vegas. I can't even tell you how tired I was there. I was like, all I wanted to do was sleep. And then when I got back, I was like sleepy. I was like, giving myself B12 shots, everything. So you should seek help if your insomnia has become a pattern, okay? So it's not just sometimes, it's all the time. You expect, you're going to be up. Or if you often feel fatigued or unrefreshed during the day and it interferes with your daily life. Many people have brief periods of difficulty sleeping. So yeah, you're going to have something going to come up, okay? Maybe anything. But if it's something that's a habit, then let somebody know. Okay, stimulus control. So it helps to build an association between the bedroom and sleep by limiting the type of activities allowed in the bedroom. So you really, when you get on your bed, you want to train your body that your bed is for sleep. Okay, like this is where I sleep. This is not like where I relax, because your body won't know. You have to train yourself. Like when you do it like kids, like you train them to go to bed and, they don't have any toys. They don't have a game. You have to do that same thing with yourself. You're not eating food. It's just sleep. So, allow yourself to do that when you go to bed. And get out of bed if you've been awake for 20 minutes or more. So if you're not going to sleep, don't just lay there for 2 or 3 hours. Get up, and then when you're tired again, retrain yourself to get back into bed. Medical treatment, so there's a ton of things that you can take. I'm not really big on like, let's just quickly take a, like a benzo, like a Xanax or something. If you need that, then okay, but that's not for sleep. It should be used for anxiety and only breakthrough anxiety at that. So I love L-theanine. L-theanine is an amino acid which helps to turn your brain off. If you got that brain that just was like, I don't know, what are you going to do tomorrow? Oh my God, how did this go? Your brain just won't be quiet. L-theanine helps with anxiety, and it helps with that brain that won't stop talking. Relora, I will marry L-theanine, I'll marry Relora. These are, Relora is an East African herb which helps you to bring your adrenals down. So if it's like, we've been at band practice all day and we've been doing this, we go, 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 go. If it's that go, 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 you could try Relora, and it'll just help you to calm down, and so your brain's not waking you up all night. And then melatonin. I've never tried melatonin, but that's the sleep hormone. And the thing with melatonin is if you use that and it gives you a hangover in the morning, then probably you don't have a problem with melatonin. It's not the issue. It'll help you sleep more, but if you're drowsy all day, then it's just not the issue. So insomnia and depression can definitely be linked. I mean, if you're not getting a lot of sleep, you're going to be more irritable, more crabby, not in a good mood. You're not going to feel good. Your body aches. You know how like you go to sleep, unless sometimes like if you're used to not getting sleep, you're used to getting 3 to 4 hours of sleep, and you go to sleep and you get 8 hours of sleep, and they go, God, I feel bad when I sleep too much, you know, because I feel achy. Well, your cortisol and your adrenals finally had a chance to reboot, and cortisol is linked with inflammation. So you feel like inflamed even when you get too much sleep or you oversleep when you're not used to getting it. But that's not something that will continue to happen once you actually get your body back used to getting 7 to 8 hours of sleep. It shouldn't happen. But anyways, definitely can impair your mood. It shifts your hormones. So you make your hormones while you sleep. You detox, you literally lose weight in your sleep that you won't lose if you're only getting 4 to 6 hours of sleep. And you definitely produce testosterone after 7 hours of sleep. So if you're low in those other things, then yeah, you can end up being depressed. Anxiety. Most adults have had some trouble with sleeping because they feel worried or nervous. Absolutely. And anxiety symptoms like tension, getting caught up in your thoughts about the past, excessive worrying about the future, feeling overwhelmed about your responsibilities, and general feeling of being revved up or overstimulated. So sleep hygiene practices, a variety of different practices and habits that are necessary for good sleep, using a full night's sleep. Sometimes people like to have like music. For me, I'm too nosy. If I listen to music, I'm going to be waiting on the next song, like to see what's going to play and stuff like that. So I don't know. But a fan, sometimes you can blow a fan and that sound drowns out like the excess background sound. And it really does help, especially babies with colic. But you can get things that you know that help you with going to sleep. So ways to improve your sleep hygiene. One of the most important sleep hygiene practices is to spend an appropriate amount of time asleep in the bed. Not too little, not too much. So sleep needs to vary across ages. I mean, and especially it's going to impact your, healthy lifestyle. So usually 8 hours of sleep. I mean, it's not like just like a hypothetical thing. You really do need 7 to 8 hours of sleep if you can. And some people can, and they just choose not to. They choose to do all these other things. You really do shorten your life if you're not getting enough sleep. So limit daytime naps. So no more than 30 minutes if you're going to take a nap during the day. Avoid stimulus and caffeine, nicotine close to bedtime. Exercise to promote good quality of sleep. Steering clear of food that can disturb your sleep right before you go to bed. And ensuring adequate exposure to natural light. So, the deadly cycle of insomnia, your mind can't shut up, poor sleep, bad daytime mood, self-inflicted pleasures, because we want to do everything, we want our cake and eat it too, and then wanting to sleep badly. You know how you get this little bit of sleep, and you go, okay, tonight, I swear to God, I am getting in the bed. And then tonight comes, you're like, oh no, I'm going to go ahead and stay up anyways. You do have to start keeping yourself accountable, get in the bed, get to sleep, especially when you can. And then you have to, because you can get into a chronic fatigue syndrome where you're chronically tired. Like no matter how much sleep you get, no matter how many supplements you take, you're chronically tired because your body's just been on go mode all the time. So you can burn out. You absolutely can burn out. Questions, comments, concerns? Yes.
I got lots.
All right.
You went through that kind of fast.
Okay.
This device, this mouthpiece.
Yeah. The dentist.
Yeah. Does that have to be prescribed, or is that something you can?
No, the dentist would literally make it for you.
Oh, okay. The
And then
mouthpiece,
they have
that's
some aftermarket ones that you can buy.
Yeah.
I thought I saw some.
Yeah, if you want to
How
get
do those
one
work? Do you
like
know?
Taylor, because it basically is bringing your jaw up. So where the tongue is, hold on. If you want to jump in, if you know, we can talk about it. But at any rate, it's going to bring your jaw forward to keep it from obstructing your airway.
Yeah. Do you know anybody that's ever worn one of those? Are they comfortable?
Actually, I did have one patient get one. Their dentist made one for them. Like, you could buy them, but like if you had the dentist make it for you, then it should be fit to you and that. Yeah. And she wore it, and all her sleep apnea went away. And one of the things that I should really mention is a lot of times it's excessive abdominal weight on your belly that is causing, like a lot more snoring and hard time with breathing and stuff like that. So if you could get your weight down underneath like 40 inches waist, your belly, you will have a lot less problems. I had a lot of people lose 30 to 40 pounds and be able to give their CPAP machine away.
Yeah, because that CPAP machine, I can't see sleeping with that thing on. That looks pretty
Yeah,
comfortable.
definitely doesn't look
The
like.
take-home one that they put you on, I couldn't keep that on my face.
You just naturally
You
take it
roll
off.
around all
Yeah.
the time?
Yeah, naturally take it
Yeah,
off.
I can't see that. That would
Yeah.
cause insomnia.
Yeah, some people can't sleep with it on, absolutely. So, I mean, sometimes people end up getting like a surgery, like ear, nose, throat, like they have a deviated septum, or if they'll get like their uvula removed so they have less crowding, adenoids taken out, tonsils taken out, so they have more room to breathe, And then also they have like the one that goes in your nose, because like some people are claustrophobic, they just can't have something over their face like that all the time. But a lot of people wear them and use them, and they sleep and they feel a lot better, a lot more energy.
I probably should have a little questions now.
It's okay.
Some of those sleep aids,
Yes.
the over-the-counter types, all three of those, I'm familiar with melatonin, but I've never seen those other two. Are those are over-the-counter drugs you can buy like a Meijer or Walmart?
Yeah. So you can get them anywhere. Relora's kind of harder to find, like more the Vitamin Shop or Swanson's or something like that online. But L-theanine you can get anywhere. And I mean, there's like some people take valerian root. There's all kind of things you can take, but I've used those two personally, and I used to recommend them all the time, and I still do. Yeah. So Relora doesn't interact with anything. Very benign East African herb. It's like a good night kiss. I swear. The first time I took it, I was like, whoa. I was like, it's bedtime. Like, it was just like bedtime, and I went and laid down. There's some people who have really high adrenals, like really, really high, and they'll take Relora. It's an adaptogen, so it brings your adrenals down. So they'll take that during the day to just calm down, because they're like, scale from 1 to 10, they're at 100, They're constantly on the go. So it's able to calm them down and bring them down where they need to be. And then theanine is amino acid. So, I mean, that helps with your brain for focus, dopamine, and it is calming. So they call that a natural Xanax, if you will.
And that doesn't interact with, none of these interact with any medications you
Theanine is like something you get out of nuts, seeds, meat. Relora is an East African herb. Melatonin is a little bit more of a wild card, but it's still natural. You can take anywhere from 1 milligram to 20 milligrams of melatonin if you needed to. And it actually, for women anyways, helps with like breast cancer prevention. But
Yeah, I heard you get this, if you take too much melatonin, it can build up in your system. And it can have the opposite effect
Yeah.
of keeping you sleepy during the day.
you're very, very sleepy during the day. Yep. I had a guy, like a normal, let's say a normal is up to 100. Let's just say, because it's not that, but let's say it's 100. His was 1,200. It was the craziest, most bizarre thing I ever seen in my life. I'm like, don't take any melatonin. He's like, I don't take any melatonin. I'm like, are you kidding me? I mean, the numbers were through the roof. And I tested it, like, through urine, through saliva, through blood. It was like a true thing. It was such an anomaly. I had no idea, but he was so exhausted. And it was his melatonin. It was through the roof. I had no idea why. But it was nothing I could do to get that reversed.
They probably didn't have a problem sleeping, did they?
No, sleep at all
apnea
times.
cause anxiety and all that stuff?
Does it cause anxiety?
Can it?
Can it? Yeah, you can be anxious from sleep apnea. Absolutely. And depressed because you're not sleeping like you need to. You don't get the restorative, restful sleep. So you're like edgy, moody, you know? Like, definitely.
How my wife would describe me.
Oh, okay. Well, yeah. I mean, if it's going untreated, you say you couldn't wear your mask at all? Never?
They sent me home twice with that, this home one.
Yeah.
I just ripped it off my face within 15 minutes.
Okay.
I even taped the second one. Still, I ripped it off.
Okay.
So I think that was costing me $300. I just gave up on it.
Oh my goodness. Did you go to the dentist to see about getting
No.
your jaw?
No,
Okay.
haven't done that yet.
Okay. That'd be the next thing, I think.
You can't get a CPAP machine without prescription for one.
You can. People get
Okay.
them. I mean,
I thought that had to be prescribed to you.
you want the settings to be, set
The
by
private.
the sleep doctor. You know, they give you the recommendations. But yeah, people order them from CPAP.com.
Okay.
So they do.
Check into that.
Yeah.
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 Is that something you can rent too?
You can rent them. They're like $96 a month to rent, and then it's like $600 to buy it. So to me, if you're gonna have it a lifetime, you just buy it.
Yeah.
You know what I mean? So you got to wear them for at least 4 to 6 hours to be considered compliant with it. You know, like okay, we can see if this actually helps you. But they do save lives. I mean, people do pass away in their sleep from not breathing. So I mean, if you're not getting good.
How does the CPAP machine work? It's just putting air to your face, or is it? You said there's two different ones. One that forces air in, and the other
It's
one
like
doesn't?
positive end expiratory pressure. So like you should have like 5 millimeters basically of pressure at the end of your expiratory phase. So it's holding the pressure there for you. It's giving you oxygen. Like usually they'll give you a number on your sleep study, like where your oxygen number is. So let's say it's 80 while you're asleep, and most people are 90 or above, so it's going to give you oxygen. And then when you're not breathing, when you're taking that 60 seconds of not breathing, it's holding pressure for you. So you're still getting, blood flow, circulation, and stuff like that to your heart, lungs, and everything. So yeah, it's like basically like pressurized air, if you will. So,
And if you're having trouble with insomnia, says you should seek help. Well, who do you seek help from?
me
Oh, okay.
or a doctor.
A doctor. Okay. There's no. You don't have to go to like a sleep clinic. Or
No, unless it's like something that can be treated with medicine. You've done everything. You've tried all the good sleep hygiene stuff. You've tried natural. You've tried prescription. You've made all the lifestyle changes you need to make. And if you're still having a problem, then yeah, you can see a sleep specialist.
And I noticed that you had good habits for insomnia, and you had exercising.
Mhm.
I've heard that you shouldn't exercise too close to going to bed, though.
Yeah, you don't want to exercise like this is that's like not before bed. It's good for you to clarify that. Just exercising on a daily basis, getting aerobic exercise, you're going to get more blood flow, circulation to your brain. So, and then you release your own natural endorphins, and so it helps with pain, it helps with relaxation. You get your own neurotransmitters from exercise. So, yeah, definitely.
Do you know what the rule of thumb is for the amount of time before bedtime?
Within 4 hours. So if you go to bed at 10, like 6 at night, will be good, and like the latest. Some people exercise right before they go to bed and it makes them tired, and they go to bed like that. Everybody's a little different, but most people might be up. You might be like stimulated and up, and then too high of an adrenal thing, and then you can't go to sleep.
Okay, so it basically it's
Like
based on the individual, and you
but
if
usually-
it's affecting your sleep, then you should probably
yeah,
change your
within
time.
4 hours. It's better to exercise if you can, like early in the morning, because you get it done. It's not like so much of a chore. Like if you exercise after work, you're kind of tired. You've been at work all day. Now you got good excuses not to exercise. It's like, I don't feel like it. If you do it in the morning, get it knocked out, That's best bet.
I think that's it for me.
Okay, any other thoughts on this thing? Anybody? Okay. Well, I thank you guys so much for attending.
Thank you.